Hello, welcome to Eva's Care, that of health. I'm your nurse, Eva Maria. On our last episode, we saw how to make a healthy juice that could help eradicate kidney stones. And in today's episode, we are going to see wounds, how they come into existence, and how we can get them into healing. First of all, a wound is a tear or break in the continuity of the epithelial tissue. It can either be open or closed. An open wound is seen on the skin, and a closed wound is not seen. It is inside, but that does not mean that a closed wound does not bleed. There are also other types of wounds, and these are amputation. This is depending on the cause. Amputation. So here is an amputated finger, but it can be any other part of the body, say a leg, an arm, or anything. It's an amputation. We have an avulsion. This includes the tear, deep tear of the skin. We have a crush. A crush, as you see, as you hear the word crush, that wound, it is evidenced by a multiple tears in the skin. We have a puncture. A puncture involves something entering the skin, and it can penetrate deep. We have an abrasion. It is like a peeling off of the epithelial tissue. We have a laceration. A laceration is like a deep break in the tissue. We have other causes of wounds, and these include the gunshots, motor accidents. We have piercings. We have animal bites, among other causes. How do you know that a wound is infected? We do work on wounds to avoid bleeding or to stop bleeding and to avoid infections. But this is a way, an easy way we could know that our wound is infected. We have to follow our acronym SHARP. First of all, if your wound is swollen, it could be a sign that your wound is infected. If there is hotness around the area where the wound is, it is also another sign that your wound is infected. If there are aches, if you feel severe pain, it is also a sign of an infection. We have redness. If your wound is turning red, it is a sign that your wound is getting infected. If you observe pus, it is also another warning sign that your wound is getting infected. Wounds heal differently in different individuals. But what causes wounds to heal differently? First of all, we have a factor that is age. Wounds heal faster in younger people compared to the elderly. And still, wounds heal faster in people that are not immune compromised. People that are immune compromised have poor wound healing. People that have diabetes mellitus have poor wound healing. People that use steroids and anticoagulants also have poor wound healing. We also have factors such as contamination. If your wound is having contamination around it, say the dressing around your wound is contaminated, this could also bring poor wound healing. How do we take care of our wounds? First of all, hygiene is key. We have to make sure that we wash our hands with soap or an alcohol-based sanitizer so that we don't carry infections to the wound. The other thing, we have to keep our dressing clean and dry. If the wound is not dressed, we have to make sure that our wound is also clean and dry to avoid infections. Sometimes the wound is open and then you observe it is bleeding. What do? If you observe that the wound is bleeding, we have to make sure that we cover it with a clean dressing. And if this bleeding persists and it goes beyond the dressing, we have to make sure that we add another dressing and exert pressure. Because if we remove the dressing, the bleeding is going to persist. So we just have to add dressing and we add a little pressure. If the bleeding still persists, we have to elevate the wound so that the bleeding is in control. The other thing we have to do so as to improve wound healing is having a balanced diet. You have to make sure you're having a balanced diet that is highly rich in proteins, and this will improve your health and it will improve your healing. The diet has to include eggs, it has to include vegetables, it has to include fish and all other types of beef. This will help your wound to heal faster. You have to make sure that you take your prescribed drugs. If the doctor prescribed for you any antibiotics, any antisteroids, any drugs that will aid in your wound healing, please take these drugs and these will help in wound healing. The other thing that is very much important that we have to do is taking enough rest. This also helps in wound healing. We also have to make sure that our wound is dressed at regular intervals so that it does not retain bacteria. And we have to make sure that this dressing is not too much so that the dressing, so that the wound gets proper aeration. Hope we can now take good care of our wounds and hope you've learned something from today's episode. If you need services of wound dressing at your home, you can always email us and we shall be at your doorstep. Not only wound dressing, but consultation, counseling, prescriptions, all these are done at Eva's Care and just at your doorstep. Don't forget to subscribe, share, like and follow. Until next time, bye-bye.